This was a case that I showed earlier that I want to emphasize the concept of a lucent interval. This was the patient who had previous trauma that I demonstrated the subdural hematoma, the subarachnoid hemorrhage, and the soft tissue swelling over the calvarium. What I pointed out previously was a small, tiny collection that was present over the right temporal lobe. This may just be a blood vessel, but on thin section images, you want to look carefully to see where this represents a collection. More importantly, on the bone windows, as we extend inferiorly, you can see the fracture that was involving the mastoid and tympanic portions of the temporal bone and then extended superiorly to involve the squamosal portion of the temporal bone. So although this was a very subtle finding of minimal blood products, we had to be concerned about the possibility of an epidural hematoma by virtue of the temporal bone fracture. By lucent interval, we mean that the patient initially does very well and has a period of time where you think that the prognosis is pretty good because the patient is responsive, etc. This patient, however, deteriorated rapidly over the course of time. As you can see by the thin section images in soft tissue window, the patient developed a large epidural hematoma. How do we know it's an epidural hematoma? It's lenticular in shape. It is associated with that temporal bone fracture, and it does not cross sutures, for example, the coronal suture. Remember that there is a 15 millimeter size diameter by which the neurosurgeons make a decision about whether or not to operate. This is 42 millimeters in size, associated with right to left shift and an element of subfalcian herniation. The delayed presentation of this epidural hematoma is not unusual, particularly when one has the fracture that predisposes you to an epidural hematoma. This accounts for the quote-unquote lucent interval in which the patient initially does well and then rapidly deteriorates. You will note as well that the uncus is medially deviated, suggesting the mass effect is affecting the temporal lobe as well.